Hello, my name is Tyffane Andrade Dristig. I am a dentist graduated from the University of Brasilia and resident in the multi-professional residency program in oncology at the University Hospital of Brasilia. The title of my work is the use of ozone therapy in the treatment of osteonecrosis by chemotherapy, a case report. This work is authored by me and my colleagues Elísia Araújo Pereira, Mariana Oliveira Gontijo, Arthur Rollemberg Cruciol Figueiredo, and supervised by the Dr. Suzeli Sampaio Porto. Medication-related osteonecrosis is the death of the bone tissue in the body caused by the inability of the bone to respond to a local trauma, and it can result in a local and systemic complications. The use of bisphosphonates or drugs such as denosumab, the drug used by the patient in this case report, combined with the risk factors such as dental extraction, poor oral hygiene, use of removable apparatus, surgeries, invasive periodontal treatments, or chemotherapy and radiotherapy treatments may favor the osteonecrosis development. So the inhibition of normal osteoclast functions appears pivotal in the pathogenesis of medication-related osteonecrosis, resulting in a reduction of the bone remodeling that hamper the physiological repair and adaptation mechanisms of the jawbone. The drug used by the patient, the denosumab, is an antibody targeting the RANK ligand. This inhibits the osteoclast maturation, which released upon RANK ligand binding the RANK receptor. Resuming, denosumab binds to the RANK L and neutralizes its activity, reduce the osteoclast activity, and the bone reabsorption. The present study aims to report a clinical case of osteonecrosis in the maxilla and how its sequels were controlled by ozone therapy employed at the University Hospital of Brasilia. This case report was a female patient, 55 years old, diagnosed with breast cancer with bone, liver, and lymph node metastases. The patient developed a drug-induced osteonecrosis in the maxilla by the drug denosumab. The osteonecrosis is found in the region of the tooth 28 by palate with approximately 1 centimeter of exposure without separation and symptomatology. So the patient was in stage 1. In the treatment of ozone therapy, he acted like a topical antibiotic in the mouth. We performed in the region of the tooth 28 debridement and removal of the necrotic bone sequestration and application of ozoned water with ozoned oil and application also of ozone gas. The monitoring and clinical intervention occurred weekly since March 2022, and the patient remains under clinical follow-up. Here we have some pictures of the case. The first picture showing the bone exposure with osteonecrosis, and the last picture is the final result. So after 6 ozone therapy sessions, the region of the osteonecrosis in the maxilla was completely closed and re-epithelialized, how we can see in the last picture, with no further bone exposure and symptoms by the patient. The debridement and removal of the bone sequestration enabled a better local action of the treatment and the tissue recovery by the patient. The therapy presented proposed tissue biomodulation and antimicrobial action, and that may be effective as an alternative treatment or in combination with other therapies in the treatment of oral osteonecrosis. In the case presented, ozone was effective, but this also may be related to the clinical management. And that's it. Thank you very much for your attention.